Our body continually gives us information about our state of health. Some things, such as indigestion, headache, or muscle strain, get our attention immediately. Our vital signs, which include temperature, pulse, respiration, blood pressure, and pain, also provide information about our well-being. Our vital signs may not always be noticeable to us, but they are measurable. For example, a steady rise in blood pressure may go unnoticed until you have your blood pressure checked.
Hello, I'm Marian Karpinski, and I'll be your host during this program. Measuring vital signs requires certain skills and techniques. Accuracy is very important when reporting vital signs to the doctor or nurse. They rely on this information to evaluate and make decisions about the person's condition.
Always take vital signs according to the instructions in the care plan. A care plan describes the person's health problems and physical limitations. It includes goals for each problem area. When recording vital signs, pain assessment, and weights, always use a flow sheet that shows multiple entries over several days or weeks. It is easier to keep accurate records or see patterns of change with a flow sheet. Record the date and time of day as well as the measurements. Always take flow sheets with you to the doctor's office. Another important point to remember is to always wash your hands before and after taking vital signs. Wear gloves if there is a chance of contact with another person's body fluid, such as mucus or feces, if the person has a condition that is contagious, or if there are open sores on the body. A rise in temperature is one of the first signs of a change in body function. Our body maintains a normal temperature of approximately 98.6 degrees Fahrenheit or 37 centigrade. When our body retains heat, this increase in body temperature is called a fever. Often, a fever is the first sign of an infection in the body. Eating, drinking, smoking, bathing, or exercising can change body temperature for a short period of time. Wait at least 15 minutes after any of these activities before taking a temperature. Body temperature changes at different times of the day by as much as a full degree. The lowest reading occurs between 1 a.m. and 4 a.m., and the highest between 4 and 6 p.m. For accuracy, routine temperature readings should be taken at the same time each day. Body temperature varies from one person to another. It's important to establish a baseline or normal temperature range for each person. You can do this by taking the temperature reading daily over several days. Hormonal changes can affect a woman's temperature reading. The elderly often have a lower body temperature with oral temperature readings as low as 95 degrees Fahrenheit or 35 centigrade. A thermometer is used to measure the body temperature. There are different styles of thermometers. Mercury-filled thermometers have been replaced with mercury-free thermometers that are numbered in either Fahrenheit or centigrade. Digital thermometers beep when it is time to read the temperature. Their display shows the degrees in Fahrenheit or centigrade. Disposable thermometer strips are flexible patches that are placed on the forehead. The temperature is shown by a color change on the strip. Electronic tympanic or eardrum thermometers are more expensive and are mainly used in the hospital or when taking an infant's temperature. Signs and symptoms of an elevated temperature include thirst, headache, flushed skin, irritability, sweating, chills, and unusual fatigue. The most common way to take the temperature is to place the thermometer under the tongue, slanted toward the side of the mouth. Taking an oral temperature is not recommended if the person is receiving oxygen, is unconscious, restless or confused, can only breathe with the mouth open, has mouth sores, or if the person cannot hold the thermometer because of paralysis or injury to the face or mouth. Taking an oral temperature is not recommended for infants or young children. To take an oral temperature, begin by gathering the supplies. You will need a thermometer, cotton pads, a disinfectant, disposable gloves, and a watch. Always check the thermometer for breakage or cracks. Wash your hands and apply gloves before taking a temperature. Use a disinfectant-saturated cotton pad to clean the thermometer. Start at the least dirty end, which is the stem end, and wash it to the bulb end by twisting the pad firmly along the thermometer. Wash for 30 seconds. Then let it air dry. The disinfectant will continue to work as it dries. Another way to clean the thermometer is to use plain soap and water. Wash for 30 seconds using the same twisting action to clean. Then rinse with warm water and dry with a cotton pad. Oral thermometers measure temperatures from 94 to 108 degrees Fahrenheit and 35 to 42 degrees centigrade. Long and short lines indicate measurements, and there are two scales, one for Fahrenheit and one for centigrade. On the Fahrenheit scale, each long line represents 1 degree and each short line is 2/10 of a degree. To read centigrade, the long line is 1 degree and each short line is 1/10 of a degree. Before taking the temperature, explain what you are going to do and tell the person he or she will need to hold the thermometer for 3 minutes with the mouth closed. Shake down the thermometer to a reading of 95 degrees or below by snapping your wrist. Insert the bulb end of the thermometer under the tongue slanted toward the side of the mouth and leave in place for 3 minutes. After 3 minutes, remove the thermometer. Use a tissue or pad to clean it before reading. When reading a thermometer, hold it horizontally with the bulb end pointed to the left. Slowly turn the thermometer until you see the silvery column. Read the number at the point where the silvery column ends. When finished, clean the thermometer using a disinfectant-saturated pad. Then air dry. Remove your gloves and wash your hands. Record the temperature reading. The average range for an oral temperature is 97.6 to 99.6 Fahrenheit, or 36.5 to 37.5 centigrade. Report any temperature that is not within normal range to medical personnel or your supervisor. Follow the same procedures when taking a digital thermometer reading. The digital thermometer beeps when the display is ready to read. Most digital thermometers come with probe covers that are disposed of after each use. Even if a probe cover is supplied, the thermometer should still be cleaned with a disinfectant solution. The axillary or armpit area is used when the temperature cannot be taken orally. This method is the least accurate and takes 10 minutes to complete. However, it is often the best method to use for people who are confused, have Alzheimer's disease, or related dementia. If the person has just washed or applied deodorant, wait 15 minutes before taking an axillary temperature. Dry the armpit area with a towel. Shake the thermometer down to 95 degrees or lower. Place the bulb end of the thermometer in the center of the armpit. The thermometer needs to be in contact with the skin. Bring the arm close to the body and place the forearm over the chest to hold the thermometer in place for 10 minutes. After 10 minutes, read the temperature, then clean the thermometer and wash your hands. Record the temperature by placing an A for axillary after the degree. The normal range for an axillary temperature is 96.6 to 98.6 Fahrenheit, or 36 to 37 centigrade. Report any temperature that is not within normal range to medical personnel or your supervisor.
The third method for taking a temperature is rectally. It is the least preferred method because of the chance of tissue injury, contact with body fluids, and an increased risk of infection. Rectal temperatures should not be taken if the person has diarrhea, rectal disease, or rectal surgery.
Always wash your hands and apply gloves before taking a rectal temperature. Then gather the supplies. You will need a rectal thermometer, lubricating jelly, a washcloth or tissues, a disinfectant pad or wipe, and a watch. Clean the thermometer with a disinfectant wipe using a firm twisting action from the stem end to the bulb end. Then let it air dry. Be sure to check for breakage or cracks. Tell the person what you plan to do. Position the person on the side facing away from you with the top knee bent toward the chest. To ease insertion, place a small amount of lubricating jelly on a tissue and lubricate 1.5 inches from the bulb end toward the stem end. Raise the top buttocks to expose the anus. Then insert the thermometer 1 to 1.5 inches into the rectum. For a child, insert the thermometer 1 inch. To prevent injury, hold the thermometer in place for 3 minutes. After 3 minutes, remove the thermometer and clean it with a tissue. Then read the temperature and remember it to record later. Clean the thermometer with a disinfectant soaked pad for 30 seconds. Let it air dry before placing in the storage container. Then clean the lubricating jelly from the rectal area with a washcloth. Remove the gloves and wash your hands. Reposition the person in a comfortable position. The average range for a rectal temperature is 98.6 to 100.6 degrees Fahrenheit, or 37 to 38.1 degrees centigrade. Report any temperature that is not within normal range. It is important to be consistent when taking an oral, axillary, or rectal temperature. If you start taking the temperature orally, then continue to use that method unless the person has a change in condition that requires another method. Consistency helps maintain accuracy. The pulse is the second vital sign. The pulse tells us how fast the heart is beating. Measuring the pulse gives us information about the circulatory system. As the heart beats, blood moves through the arteries. The throbbing of the blood against the artery walls creates the pulse. You can use your fingertips to feel the pulse on particular areas of the body. Exercise, pain, fear, internal or external bleeding, and fever can elevate the pulse rate. Some medications can lower or elevate the pulse. Infants have a higher pulse rate than adults. The most common site for taking the pulse is the radial artery, located on the thumb side of the wrist. Another easy place to feel the pulse is the carotid artery, located on either side of the neck. When taking the carotid pulse, use only one side of the neck to avoid constricting blood flow, which may cause dizziness. The person should be at rest for 15 minutes before taking a pulse. Always wash your hands to reduce the spread of germs. Tell the person what you plan to do. Make sure he or she is sitting or lying comfortably with the arms supported. Find the pulse by placing the tips of your first 3 fingers on the person's inner wrist on the thumb side. Feel for the pulse by pressing lightly. Too much pressure can stop the flow of blood, especially for older adults, and you will not feel the pulse. Never use your thumb because your thumb has a pulse of its own, making it difficult to get an accurate reading.
There are 2 important qualities to notice about the pulse. The first is the force of the beat. Is the pulse absent? Or is it difficult to feel and feels kind of thready? A weak pulse is somewhat stronger than a thready pulse. A normal pulse is easy to feel, and a bounding pulse is full and spring-like and doesn't go away under moderate pressure. The other important quality to notice is the rhythm of the pulse. Does the heart or pulse skip a beat, or is the time between beats the same? An irregular pulse is more common in an older adult.
If the beat is irregular, count the beats for 1 full minute. Use the second hand on your watch. Start counting at the beginning of a minute or at the half minute. If the beat is regular, you can count the beats for 30 seconds and simply double that number to get the pulse rate for the full minute. A normal adult pulse rate is 60 to 100 beats per minute. Report any pulse that is below 60 beats per minute or above 100.
Record and report any irregularity of beats or any change in the force of beat.
If you can't feel the pulse, or if it is irregular, use a stethoscope to listen to the heartbeat. The stethoscope has earpieces, tubing, a chest piece that includes a diaphragm and bell. The diaphragm and bell are used to hear body sounds. Use the diaphragm when listening to the heart. Place the earpieces in your ears facing forward and check to see if the diaphragm is on by tapping it gently with your fingers. You should hear a magnified tapping.
If you don't, it may not be turned on for that side. All stethoscopes are not the same. This stethoscope has two tubes that go, one goes to the bell and one goes to the diaphragm, so it's not necessary to make any adjustments for either side. With this stethoscope, you'll notice that from the earpieces to the chest piece, there's only one tube. So in this stethoscope, it's necessary for you to turn it to either side, the bell side, or to turn it to the diaphragm side. So that's why you want to listen for that magnified tapping sound. The other thing to remember about stethoscopes is that once you have the earpieces in, you want to be in control of the chest piece, because if you bang this against the table or a chair, it can be very painful to your ears.
The apical pulse measures the actual beating of the heart. Apical refers to the apex or tip of the heart. To take an apical pulse, begin with a clean stethoscope. Use a disinfectant wipe to clean the earpieces and diaphragm. Expose the left side of the chest. Place the earpieces of the stethoscope in your ears. Locate the apex or tip of the heart by placing the diaphragm about 2 inches below the left nipple and a little toward the center of the chest. Adjust the position of the diaphragm until you can hear the heartbeat clearly. Then begin to count the heartbeats for 1 minute. Each lub-dub sound is 1 beat. Listen for the rhythm of the beat. Is it regular? Or is it irregular? Record the rate and rhythm. Respiration is the act of breathing. Measuring respiration is one way to monitor how the respiratory system is working. The same factors that affect the pulse may also affect respiration. Exercise increases the pulse rate and